Hey guys, it's Melissa back here with a new video, and I'm here with some familiar friends.
In this video, we will be using emojis to demonstrate childbearing and medicine in the 1800s.
Back in the day, medicine wasn't as advanced as it is now. There were different types of painkillers that are considered as drugs today. Some include cocaine, heroin, cannabis, which is also known as marijuana in this century. Once doctors told them that they were super duper addictive, they took in most of the medicine. Later in the 20th century, they were established as unhealthy for the human body. Because various doctors had little knowledge during this time, they often prescribed their patients with whiskey and medicine with mixed herbs.
In the 19th century, bloodletting, which is the surgical removal of patients' blood, became the solution for therapeutic purposes and a solution to disease. They bled till they fainted, which cleansed the bowels and stomach from poison. The main process of bloodletting was to use leeches to drain the blood. Francis Joseph Victor Broussais, a French physician, would put up to 50 leeches on his patients. Doctors would dose their patients with purgatives and cathartics. Bloodletting wasn't pleasant nor effective. Transfusing human blood into one another was introduced for the first time. British obstetrician and psychologist James Blundell performed human-to-human blood transfusion for the first time. He injected patients suffering from internal bleeding with about 12 to 14 ounces of blood from several donors. Unfortunately, the patient died after showing improvement. In 1846, anesthesia became more widely available, helping expand options for surgery. Surgeons would use ether as they remove a tumor from a patient's neck. In 1883, mental illnesses are studied more. The expectation that mental institutes would cure the mentally ill weren't true. The hospitals were overcrowded and the treatment that the patient received was poor.
In the 1800s, childbearing was considered something all married women should do. They were responsible for the birth of the children and also taking care of them. Married women usually had 6 or more children, which was considered common during the time. However, this whopping amount of children would cause much concern for the nutrition and overall health of the child. Pregnancy was an unexpected and dangerous recurring life event because the technology and medicine had not been fully developed yet. Childbearing was dangerous for both the mother and the child. The mother had a 1 in 8 chance of dying. Just like today, abortion was very controversial. In the 1800s, women usually had abortions when they got pregnant before marriage because of how unacceptable it was to religious ideals. In the mid-1800s, abortion became more common to limit the size of families.
During labor, it was not only the pregnant women doing everything. There was actually help from many women. One example of these women were called midwives. Midwives were especially hired by their masters to help the process of childbirth. Highly skillful midwives were highly appreciated by the masters. During childbirth, there were really no painkillers. The main painkiller was alcohol, which did not even help that much. So the woman had to go through all the pains in order to give birth to their child. There was one extraordinary woman. She was the author called Kate Chopin. She gave birth to 6 children in 6 years, and in all 6 of her childbirths, she chose to use the drug chloroform. Chloroform is a drug that would decrease the amount of pain during childbirth, so she wouldn't have to suffer as much. However, her doctors rejected this idea because they said that the Holy Bible said that women had to go through all the pains and sorrows during childbirth in order to love their child more.
Hey, thanks for watching. Hope you enjoyed learning a few things about childbearing and medicine.